For me, community violence is violence perpetrated by individuals from the community for various reasons, whether it's trauma that they've suffered from their past, whether there's food insecurities, housing insecurity.
It could be gunshot wounds, stabbings, or assaults. It can happen on the streets, in the parks, near schools. It can happen to anyone.
And people can be impacted by violence without directly being shot, physically assaulted, or stabbed. I know people that have lost their whole families. They're just as impacted, if not even more.
People who are closest to the problem is closest to the solution. The most impactful way to do public safety is to involve community and invest in community. And hospital-based violence intervention programs are very valuable to the ecosystem.
If you examine the population that has been shot and you layer over several other risk factors, we're actually talking about a very small population that has the greatest probability of being re-injured or worse, for fear of their own safety, harming other people. By supporting individuals and communities who are at the greatest risk, HVIPs have an opportunity to transform lives and communities, and in doing so, disrupting cycles of violence.
We bridge the gaps between healthcare needs and social needs by building that trust and relationship with the patients and learning what their needs are beyond their healthcare needs. We try to address some of their short-term goals, such as relocation, employment, resume assistance, making follow-up visits to doctor's appointments, obtaining health insurance if they don't already have health insurance.
Care for the community doesn't end when the patients leave the hospital. The hospital-based violence intervention program is there to help not only patients that have been seen in the trauma center, but also help them and their families through the traumatic time, and also subsequently to try to prevent other people from becoming trauma patients.
We intervene with individuals at their crossroads. Those individuals are in that state where I could retaliate and become re-victimized, or I can let this thing go and move on my life.
HVIPs connect with patients at their bedside and continue that relationship through long-term case management in the community.
All right, bro. Good seeing you, bro. What's up, bro?
For sure. HVIPs often partner with violence interrupters who are mediating conflicts in the street. At the end of the day, we are leveraging community members who are doing different types of life-saving work.
It's a really difficult thing to measure success in this realm, because if there's success, then I won't see those people as patients in the trauma center. So I think that the success is really measured by the impact on the community and the opinion of the community about having the resources available.
I let my presence be part of what I'm trying to say. You know, my compassion, my empathy, my understanding, like, I'm here to help. I'm here to make sure you get through today. And I follow the client once they leave, and I make sure they have the understanding. Once you leave here, I'm still with you.
When I first met Ernest was at Eden Hospital when I had got shot. And he came, he introduced himself, told me more about his program. And he, we talked about the violence and all that, which kind of was an eye-opener for me. Instead of like running the streets, I could be doing something much better with my life.
I got shot in my stomach, and I just remember kind of laying back in my bed and just crying and praying and just like, help me. And literally within like the next week, Youth Alive came and did a home visit for me. That was my first introduction of like how powerful a conversation could be, how powerful someone that you don't know showing up and talking to you about what your life can be.
I ain't seen him in so long. How you feel? The most gratifying thing about this work is that we're saving lives. I think that we have the opportunity to keep our community whole and heal them at the same time.
For us to come in and be able to offer them services and to prevent retaliation and re-victimization and to help them to recover on a successful path throughout their life. I feel very good about that.
Ultimately, we're trying to build a community that has gone from trauma to trust. Our young people are opening up businesses, they're going to college, they're learning, we're using public safety dollars to do it. We are rebuilding, we're restoring hope where hope wasn't before, and we're giving opportunity where opportunity didn't exist before.